Welcome to Western Medicine on Talk 1260 KTRC. You're listening to the Humanity Behind the Vanity. This is Dr. Dan Ronel. I'm a plastic surgeon here with my wife Betsy Ronel. We're going to talk about what today?
Lots of stuff. I read an article in Allure magazine this month about two twins and the comparison and contrast, I guess, between their plastic surgery results. So I wanted to hear what you had to say about that. And you can describe the article better because I made you read the whole thing.
Oh, you're talking about, this is a synopsis of a article printed by a guy called Dr. Betsy Ronel, who's one of the
Very
giants
famous,
of plastic surgery. And he did a study that looked at identical twins who grew up, grew up differently, and one ended up overweight and one ended up skinny.
Okay, fine. So let's continue to introduce the show. So we're going to talk about that.
Okay.
Then we have our tip from Marion Urbon.
Right.
And
she's going to talk about biking. I think protecting your skin while you're biking, right?
And we're going to talk about, and oh yeah, we have Tess too. Okay, so we've got Tess, who's fabulous. We love her. She's a yoga tip for us. And we're going to talk about something that's always puzzled me and keeps this industry going. It's actually about skincare. There's current trends now in the New Beauty magazine that's out on your newsstands right now. Yeah, and it's featuring articles about vegetable and fruit extracts and ingredients. Putting them in skincare products. So I'm like, what? Okay. I mean, I knew about this a long time ago. Everybody has. Sure. But it's now the current focus. Right. So does that mean we have to throw out all our own stuff and add new stuff? I mean, what? So even I am confused about this. So we're going to talk about that.
Okay, fine.
All right.
So let's start. So what the study showed, basically...
This is the Dr. Gurion. What is
yes, Gurion.
Gurion, sorry. Okay. He's in Portugal or Brazil.
No, he's in the United States.
Oh.
He's very American.
Sorry. Oh, okay.
His ancestry is not American, but he is he's one of the giants of American plastic surgery.
Okay.
Anyway, basically, if you're overweight, you have more subcutaneous fat and you look better. That's really what it boils down to. And so,
how overweight are we talking here?
No, just a little bit. You don't have to
We're not talking, this is not giving way to morbid obesity being acceptable.
But on the other hand, another way of saying it is if you're very skinny, you can look older.
Here's a quote from Catherine Deneuve that I recently heard on TV. And of course, she said it much better than I will say it, and she said it in French, which I'm not going to do for you. She said, as you get older, you have to choose between your derriere and your face. You can add a little bit of weight on your derriere and your face will look better. Or you can have a skinnier derriere and your face will look more gaunt.
And she's right.
And she's gorgeous.
She's right, because as you lose weight and you get really thin, then you lose a lot of the subcutaneous fat in your face, and that is what makes wrinkles come out and makes the contours more angular.
But we all want to be thin.
And this has sort of been never studied, and sort of people just talked about it. But now with this study, which showed identical twins, one who...
How old are they in the study?
Yeah, they range between 40 and 70, I think.
Oh, okay.
And the one that was skinny looked older. And
we
so,
all strive to be so thin.
Right, but what that does, but that kind of fits with the modern approach to facial rejuvenation.
That's what I was going to ask you.
Right, which is about adding volume to the face.
So if you, sorry, go ahead, doctor, please, go ahead.
Thank you so much. And volume can be added by lifting fat that has dropped down and lifting it back into its proper position. It can be added by injecting volume, such as a fat or artifill or other fillers. And I think that is a much more natural way to restore youth, is to rejuvenate the face by restoring it where it was before. So in the example of a cheek that's dropped, it's better to lift it up than to just add a whole bunch of stuff to it. Does that make sense?
Okay, maybe I wasn't paying attention, but wait a minute. So, are you saying that if you want to be really skinny and you enjoy being thin, and your face is going to, age a little bit more severely than someone who's maybe 10 pounds overweight, that you'd rather do a facelift than injectable filler?
No, that's not what I'm saying.
Okay.
I'm saying,
what are you saying?
I'm saying one or the other. I'm saying either one of those is fine because the modern facelift, as well as the modern technique of injecting fillers, doesn't just add volume, but it pulls up what has sagged. Right. It restores tissue where it was before. And for example, the old style lower eyelid blepharoplasty or the old style facelift used to cut out a lot of fat. Used to cut out a lot of
Right, it was much more severe.
And now we reposition it.
Right.
And by repositioning the fat to where it was before, it looks better and it looks more natural.
Okay, I see, in my mind we're straying a little. So what are you saying? Can you get skinnier as you get older if you choose to live that way?
Of course, it's very healthy.
Well, it's also okay to be 10 pounds overweight as long as your heart is healthy. That's totally within reason.
Yeah.
But so you're saying that women who are very fit, say, and who really do enjoy being very thin, in fact, prefer to be on the skinnier side than not, that they can still live that way as they age, say when they're over 50, because there are answers for them, such as a facelift and or filler.
Correct. That is true.
It'll keep their face supple and soft looking.
Yes, it will help. But the point of the article is to know that as you get thinner, your face will get older. Yeah. And that is sort of a generality.
It's too bad.
Wow.
Trying to keep our behinds skinny when our face gets skinny, that ain't where it's supposed to leave us.
Yeah, I understand.
That's funny. Okay.
And when I do facelifts, actually I get better results on people who have more subcutaneous fat, who have a little something that I can work with. It looks better than people who are achingly thin.
I'm not talking about aching. I am not talking about, that to me is drastic, just like morbid obesity is drastic. I'm talking about a woman who is at her, typical, her weight that she should be, or slightly below, within 5 pounds. I'm not talking about someone with an eating disorder. I'm talking about someone who really enjoys being thin and fit and eats very consciously and does not want to take in a lot of fat, does not take in the carbs. Everybody, this is not me. I wish it were. This is not me. I'm on the side of 10 to 20 pounds overweight. But anyway, those women, because they work very hard to look a certain way, and what are you doing for them? Can they continue to do that?
Yes, they can. That's very healthy, and it's a very helpful way to live, and they'll look better because they're healthier. And the solution for them is, to start with fillers and then eventually go to a facelift if that's what they want to do.
Okay, and those of us who are 10 to 20 pounds overweight, what do you do for us?
It's the same thing, but you don't need as much.
Okay.
That's the point.
So our face is softer.
That's the point, right.
Okay.
Right.
So, all right. So the conclusion of this whole thing was what? Just wrap it up one more time. I think I'm getting that flu that everybody has. Okay.
The conclusion is that this is a study that just validates what we've known for a long time, is that as you lose weight, you can look older and gaunter, and that's basically what it validates. And it also says that if you need to approach facial rejuvenation in somebody who's really thin, you need to think about adding volume back to the face, not adding pounds from eating, but adding volume back to the face, and that's the story.
Here's something I noticed. I've always looked at the older, formerly very famous supermodels, Christy Brinkley and Kathy Ireland, for example. They look great. I mean, they've always looked great, obviously, but they're rounder as opposed to more angular as they've, and I think they're both over 50 now for sure. And if you look at Christy Brinkley's body, she's not real thin. I don't think she ever was. I don't think that's her body type to begin with. But her face looks fantastic, as does her body, because she's not stick thin, but she's in shape.
Right.
And so that's helping her face. I don't think she's probably, I doubt she's even had a facelift yet. She has good bones.
Ultimately, what's more important is keeping your body fit, cardiovascular.
Right.
That is the most important thing. And I'd rather have somebody much healthier than trying to be overweight
or being too thin and unhealthy.
Right.
As a means of getting thin.
Right. You don't want to have atherosclerosis on one side and have your arteries clog up because you're eating fat.
Right.
But okay, listen, we have to wrap things up.
Okay.
We're going to take a short break. Thank you for listening.
And Daniel will come back full of life in the next segment, I promise. I'm falling asleep listening to him.
Okay, you're listening to Western Medicine Talk 1260 KTRC. We'll be right back.